Stephanie, come on up. Gulf Marine, how much shoreline do you have in the port? 50 acres in the port. One of our hidden, how many have ever heard of Gulf Marine? A few? A few more are going to know. There we go. There we go. We're going to know a lot more. Stephanie, give her a big round of applause welcoming her.
Okay, good morning. I am so excited to be here this morning talking with everybody about healthcare. And actually, I am a self-proclaimed healthcare nerd. So I am the HR director of Hendry Marine Industries, which is the holding company for Gulf Marine Repair and Anchor Sandblasting and Coatings, which is located at the Port of Tampa. So I already introduced myself, but just to give you some foundation of my experience, I've actually worked in human resources for over 25 years. I know, gasp, right? I still can't believe it. But for the first several years of my career, I always dreaded healthcare renewals because it was daunting to go and deliver a healthcare renewal to your employees that said, hey, by the way, you're going to pay more for your healthcare. And by the way, your plan design is going to be cut and your benefits are not going to be as sufficient as they were before. And that's a terrible message to have to bring to your employees year after year. And I'm sure as leaders in the organizations that you serve, that is something that you don't enjoy either. So a little bit about our company. I already mentioned that Hendry Marine is the holding company for our two other operating entities, and we have 300 employees. We have about 180 employees that are covered on our health care plan. And our company actually funds 80% of the cost of the premiums for our health care plans. So we're really proud of what we've been able to accomplish. But if I were to sit here and tell you that you will be able to learn something today that you can take back to your organizations and be able to really, I consider, tame the beast of healthcare, I assure you, you will take something away from this message that I'm giving you this morning. So if you look at the slide, you can see that year after year, Hendry Marine was challenged with having healthcare cost increases, and our plan designs were getting cut, and we were paying more for healthcare but getting less. And that also equates to the quality of healthcare being reduced. And in 2017, we hit our high where we got a 75% increase. Again, we actually have, with our 300 employees, a lot of middle-aged gentlemen that work for the company. And unfortunately, that year we had a lot of high-dollar claimants. So we hit a high of almost $14,000 per employee per year, and it was at that point that we decided that we needed to take control of our healthcare cost. I should have mentioned that at the time this was happening, we were on a fully funded healthcare platform. So realistically, what that means is the healthcare organization that we were working with was happy to take our money and continuing to increase our cost year after year. We had no control over the data because we couldn't see it, nor did we have control over the type of plan that we wanted to offer to our employees. So herein lies the story that I'm very excited to share with you this morning. So this is not a surprise. Our healthcare system is broken. So realistically, what's happening is the cost of healthcare premiums continues to increase, while the cost that we're able to spend on employee wages is not keeping up with the cost of the healthcare premiums or inflation. And that is a vicious cycle because what's happening is almost 50% of employees are not getting the health care that they need. They're avoiding it because they simply cannot afford it. So again, it creates a vicious cycle of healthcare spend and not getting different results. So I don't know if you guys were aware of this, but in the state of Florida, we pay 366% above Medicare for our healthcare cost. Exactly, wow. I get the same reaction when I present that slide at other conferences. And it's true, we actually are the third highest payer of healthcare in the United States. So here's the question. How did Hendry Marine overcome the healthcare battle? And one of the things I also wanted to mention earlier, and it was on one of my first slides, was I've actually been working in the space for 8 years. I think I mentioned that, but my prior company that I worked with actually went to this type of healthcare system, which worked outside of the traditional healthcare plan programs. So I actually have 8 years of experience in this space. So it's kind of like we call ourselves healthcare disruptors, and we're really proud to be part of that, you know. So one of the first things we did was from 2017 to 2018, we moved into a self-funded healthcare model, which allowed us to take control of our healthcare costs. It gave us control over the plan design and the things that we did to implement significant savings to our plan with continuing to provide quality health care to our employees. There are several strategies that we implemented over the last 5 years. However, the ones that are in the stars are the ones that had the most significant impact to our employees from a cost perspective, financial savings to the bottom line for our organization while still continuing to provide quality health care to our employees. And I'm one of these HR leaders that you can tell me that something is wonderful, but if it's going to impact my employees and their family members, I'm not interested because my employees come first. And when I started working in this space, it was very important to make sure that my HR team was going to continue to provide excellent service to our employees, that they were going to get the support that they needed in this new healthcare space. So we implemented a lot of different strategies, and I want to make sure you guys understand these strategies are not built overnight. They take a couple of years. So when you look at your healthcare plan, it is not a one-year strategy. You're not moving from Blue Cross to United to Cigna to Aetna to keep dodging the cost of your premiums from going up. What this is a realistic approach to continuing creating your own healthcare plan spend over the course of time that you have control of. So this is exactly the trajectory of how we started taking control of our healthcare spend. So I joined the company in December of 2019. We were fortunate that they were already on the self-funded platform with a company that I had already been previously working with. So that was a match made in heaven when I went to Hendry Marine. But they allowed me to continue building the healthcare strategy to ensure that we were building a platform that would be sustainable from a premium standpoint, quality standpoint, and again, value-based healthcare program that would be sustainable for several years. So as you can see, we implemented different strategies over the past few years, and we're going to get into what the results are today in just a minute. So one of the other items that we implemented was a transparent PBM, which is a pharmacy benefit manager. I know in HR we use a lot of acronyms, but they do in healthcare as well. So as you can see below, we actually went from because I can't read that far, $190 per employee to $124. So we actually, when we moved away from a traditional pharmacy benefit spend, we saved 30% on our pharmacy spend immediately when we moved it away and took control. And that is significant dollars. And just to put more value to that, the value proposition, when we looked at our our pharmacy spend in the beginning, we were at over 18% pharmacy spend. When we moved it, we actually moved into a pharmacy spend now that's 11% of our total healthcare spend. So we've actually reduced it significantly by taking control and moving it away. This is one of my favorite passion projects that we've had. A couple of years ago, we recognized through having access to our data, which again, how do you drive a healthcare plan strategy without knowing what your data says? How can you decide, or how can one of the carriers decide, or your insurance consultant decide what your company needs if they're not sharing the data with you? In other words, you're basically writing a blank check to someone who's taking control of your spend. So we had data transparency and allowed us to identify a real significant issue of a majority of our employees not getting their preventative wellness examination. And as most of you may know, when the Affordable Care Act was passed, a preventative wellness examination is covered at 100%. So this just meant that the employees were avoiding going for one reason or another. They wanted to stay working because they needed to make money. They didn't have the time, nor did they want to take the time off to go. So our company came up with a solution which is called Walk-On Clinic. And I want to recognize Mike Tauber. He's in the audience this morning to support me. So Mike is with Walk-On Clinic, and Walk-On Clinic we call our secret weapon. So our secret weapon was to provide health care on site at the shipyard. This is actually a primary care doctor's office that we have on site for all of our employees and their covered dependents. We do not charge our employees time off of work. We don't make them clock out. They go to the clinic. They go get what they need, and they get their prescriptions called in, and they get taken care of by a nurse practitioner as well as a medical assistant that is on site for their needs. And we implemented this in January of 22. And since that time, our utilization for our preventative wellness benefit has increased to almost 50%. We also have had over 70 employees and their covered family members identify the Walk-On Clinic as their primary care doctor, which means that we have more people going in for their preventative wellness tests and getting the care that they need because it's right there on site. And that was our way of taking care of our employees. In addition to that, we had at least 2, if not more, cases where people were identified with life-threatening illnesses that they did not know they had until they went to the clinic. So can you imagine the catastrophe that would have occurred with their family had they not gone for medical treatment that we offered on site? So it's such a rewarding opportunity and giving back and taking care of your employees. So financial results. So this is the start of the impact that the changes we made were having. So at the end of 2021, our company had a surplus of over $1 million in our bank account from our healthcare spend. I don't know about you or how many companies can say that they actually have money left over at the end of a healthcare plan year, but we did because we took control of our costs. At the end of 2022, we had over $500,000 in surplus for our healthcare spend. And the money that we invested back from 2022, into 2021, we took that $1 million and invested it into our claim spend for 2022. The same applied for 2023 when we had the leftover money from 2022. So, but wait, there's more. So, I told you I'm a nerd. I've become a healthcare nerd over the past 8 years. So, you know, the most important thing, we've been talking about workforce development and recruiting and retention. How important is it for your story to be told and say, you know, we kept our health insurance premiums flat for several years, did not give our employees an increase. We have an on-site wellness clinic that allows us to take care of our employees. You talk about a recruiting and retention tool. I mean, it doesn't really get much better than that because the money that we have available that we're not spending on our healthcare plan, we can invest in our capital budget. We can reinvest that money into increases for our employees. And there's so many other things that we can do. So I had a lot of aha moments over the past several years, and this has been an ongoing learning process for me. And one thing that I will reiterate to all of you is good data and transparency to that data is so key in your success with your healthcare plan. It is your second largest line item on your financial statement. If you're not sure what your spend is or why you're spending that money, you may want to reconsider the insurance consultant that you're working with and consider the people you're partnering with from a vendor standpoint. We need to make sure that you're looking at the people that are working in the best interest for your employees and your organization, not theirs. I know that's a bold statement, but it's true. So our HR team has had more support than we had before. More importantly, our employees have more advocacy than they've had before. One of the things I share with my employees constantly is healthcare is a consumable product. If you are going to Best Buy and buying a TV, you're going to spend several weeks researching that TV and know everything about all of the details. Why would you not know the details about something you're spending money on every week? And they really understand it from that perspective. So it really gives them light into a problem that is ongoing. This is one of my favorite slides. So stop hitting the easy button. Stop saying yes when your carrier or your insurance broker partner comes to you and says, we're providing you with an increase this year. We're so sad, too bad. You need to make sure, I call that healthcare insanity. It's doing the same thing again and again, expecting different results, right? So Yvonne's standing there, so apparently I'm getting the gong. So this is important stuff, you guys. So the fact is that we're continuing to build our healthcare plan strategy. In 2023, we added tobacco cessation. We have blood work that's done on, the walk-on clinic. Couple of examples. So 2024, we're looking to bring pharmacy prescriptions on site at the clinic. Again, it's access to convenient care for the employee members and their families. So that is all I have today. I also wanted to recognize Matt McEwen, and he's with a company called Imagine 360. He flew in from Texas to see me speak this morning because I've been such a huge advocate for their company, and they're our partner that has helped us with much of the success that we're having. So I'm happy to answer any questions afterwards, and I want to thank all of you for your time.